So the question then with these tests is, when do we want high sensitivity and when do we want high specificity? Ideally, we'd have a sensitivity of 100% and a specificity of 100%. Unfortunately, that's not really how it works in the real world. So the question is, which one do we want to optimize? Sensitivity is the ability of a test to detect you actually having the condition. So things that need high sensitivity are tests for, let's say, contagious diseases. That is, if someone comes in and has a rapid result HIV test, we want to go ahead and err on the side of caution. That is, as a healthcare provider, we would rather tell someone that they have HIV and have them not have it than tell them they don't have HIV and have them actually have it. The reason for that is because of the tendency of the disease to spread. That is, if I tell you have HIV, you're more likely to go ahead and seek outside care, see a healthcare provider, take preventative action in your sexual behavior, and also your everyday life. So that is, by warning you, you're going to be overly cautious. Now, if I tell you you don't have HIV, that could have more severe consequences if you actually did. So screening for things like HIV, things like tuberculosis, any kind of contagious disease, we want high sensitivity on those. We'd also like to have high sensitivity on things such as drug testing. The military is kind of notorious for that. The drug testing they give has extremely high sensitivity. Such high sensitivity actually that they do batch testing. Now, high sensitivity in drug testing means that in reality, we're flagging way too many people as positive. That is, when you take a drug test, especially certain types of urine tests, you're way more likely to get a positive than you are to actually have taken any type of illegal substance. Now, high sensitivity, once again, throws a lot of false positives, but with drug testing, we'd rather flag you as positive and then go ahead and test you a second time with a more expensive but more accurate test. High sensitivity, once again, tends to come at the cost of low specificity. So let's talk about when we might want high specificity. High specificity means we're very good at telling you don't have an illness. So for instance, if we're running trials on treating a certain type of cancer, we'd want to go ahead and screen people with a high specificity. That is, we'd want to go ahead and weed people out who do not actually have the illness. Because if we're running a trial for a new type of drug, it would kind of throw off our trial if we're not certain people actually have it. Another type of testing that we might actually want a high specificity is if we're going to go ahead and give you a treatment that has really, really bad side effects. So for instance, if we're treating a, say, more rare disease and the side effects of the treatment might actually result in death, we'd rather go ahead and weed you out if you don't have the illness than treat you with something that might actually kill you. So this allows us to kind of explore differences between high sensitivity in cases we'd want to use that, and high specificity in cases we'd want to use that. One final word about false positives. When we have high sensitivity on things like, let's say, breast cancer screening, and we tell a lot of people who don't actually have the illness that they do, there can be really severe side effects in terms of mental wellness or mental health. That is, telling someone they have an illness that they don't actually have can result in higher levels of stress, raised blood pressure, and also, once again, long-term mental health consequences. So high sensitivity, while it's good in very specific types of medical circumstances, does have fallout for it.